You say churches, mosques, and other, some agencies and institutions have, spoken about this, but I would have thought that perhaps we would have vaccination centers in churches Sundays, in mosques on Fridays, higher institutions every day.
Yeah.
Have you seen that happening?
Yeah. No, you say it is very, very valid. The point you're trying to make is very, very valid, and it's a very wonderful suggestion, because you are now going to the people, themselves out there to meet the people, and I think it's a good thing. But again, you're talking about the situation of healthcare infrastructure in the continent and how much government are spending in healthcare. Now, Nigeria was signatory to, I think, a protocol, an AU protocol, I think in 2000 or 2001, where it was agreed that African countries should not spend less than 15% of their national budget in healthcare infrastructure. So they must spend as much as 15%. But that has not happened. Nigeria sometimes spends as low as 4%, 5%, and perhaps I think in recent years the highest has been about 6 to 7% of the budget of this country towards healthcare. So that is not in any way adequate. So for you to begin to talk about, and like I said, it's a wonderful suggestion, getting this into mosques and churches and so on, even the traditional places where they are supposed to have them, in hospitals, and so you might not have some of these facilities in those places. And so it is an issue. I mean, it's wishful thinking. It's a very good thing to have it done, but we know that in practical terms, government have not shown enough interest in the issue of ensuring that healthcare infrastructure or healthcare is adequately funded in the country. And now we are having very serious economic problems, and where the country has gone, borrowing money, from different parts of the world. And so it is even going to be a very, a much more difficult situation.
It's going to be much more difficult, which means that we're going to have more vaccines expiring.
I think what we should have is that states, regardless of the difficulties, states should step up their efforts, because look, this is our country, and we know what goes on. We know that regardless of government claims about not having enough money to carry out functions of government, we know that even as we talk that public funds are being stolen left, right, and center. Just yesterday, I read somewhere that about 7.8 billion naira is going to be spent on the allowances, emoluments of former heads of state and their deputies and other government functionaries. 7.8 in a country that is racked with serious mind-boggling poverty. I mean, so you look at it, you just realize that we are not getting our priorities right when it comes to things that have to do with the public. Government, tends to look for, tends to be contemptuous of every attempt to resolve some of these public issues. Look at, the ASU issue. Look at, or the problem of, the doctors and so on. But when it comes to spending money for the privileged elite in this country, they do not find it difficult doing that. So, but we need to spend much more. But don't forget that when the Gates came to Nigeria, he was looking at the two sectors of Nigeria's political economy. He identified healthcare, infrastructure, health, and then education as the most important of all of the, public, institutions that we have in this country. Because once you resolve the problem of education and you resolve, then you guarantee the future of the country. And when you resolve the healthcare infrastructure issues in this country, then you resolve the healthcare, the healthcare of Nigerians, and that would, help in providing for the national economy.